Hi everyone, my name is Jessie Palazzolo. I'm an environmental health specialist with Arapahoe County Public Health, also known as ACPH. This webinar will cover some important aspects within childcare health and sanitation regulations regarding disease prevention and personal health, with a focus on illness reporting, illness log documentation, as well as disease control measures. The intention of this resource is for programs to use as a staff training tool, as well as aligning daily operating practices to the regulations. So what are the goals for this webinar? Well, it's to improve communication with our partners, increase disease reporting, which can then allow for earlier implementation to help prevent and mitigate further disease spread, and therefore result in an overall decrease of infectious diseases within facilities. Overall, it's about helping us help you. We want to have meaningful partnerships, and to do that, we want to build trust within the community, which is our priority. We have tools, resources, and expertise to help you manage infectious disease while keeping you operating and serving families. Let's start with the health and sanitation regulations for childcare. Specifically, I'm reviewing disease prevention and personal health, and then heading down to letter C, which states disease outbreaks shall immediately be reported to the department and shall not be delayed due to a lack of diagnostic testing. Cases and outbreaks of reportable communicable disease shall be reported to the department in the time frame stipulated by 6 CCR 1009-1, which are the regulations pertaining to epidemic and communicable disease control. I'm not going to read these aloud word for word, but want to point out that childcare facilities need to manage and control disease transmission by consulting with either your health consultant and or the department, which in this case is ACPH. A written policy needs to be implemented for staff and children regarding symptoms of illness and exclusion requirements. And children need to be continuously observed for common symptoms of illness. Notice there's two links on this page, including the guidance of infectious disease provided by CDPHE, which is a very useful guide with a list of reportable diseases, symptoms, transmissibility of pathogens, exclusion guidelines, etc. And then lastly, How Sick is Too Sick, which is a living document created by CDPHE and Children's Hospital of Colorado that can be used as your program's staff and child illness exclusion policy. There's no need to recreate the wheel, especially with such busy providers and busy families. Our child care and schools team, along with communicable disease epidemiology, created these two flowcharts with the goal that providers could more easily identify a suspected outbreak based on associated disease symptoms or a formal diagnosis. Keep in mind, a formal diagnosis by a physician is not necessary. If children and staff have similar symptoms, that alone is enough to report a suspected outbreak. We believe this will encourage disease prevention compliance across Arapahoe County child cares and schools. It will also aid in faster implementation of mitigation strategies that could help decrease the duration and severity of an outbreak. Okay, so we have two flowcharts here, and the chart on the left covers common gastrointestinal illnesses, also known as GI illness, which include both viral and bacterial pathogens. Norovirus, which I'm sure most of us out there are familiar with, is approximately 80% of the GI illnesses that circulate in congregate settings like childcare, schools, camps, etc. However, other viruses and bacterial infections can cause vomiting and diarrhea. The chart on the right covers respiratory illnesses that most commonly occur in childcare facilities. RSV, influenza, SARS-CoV-2, which is COVID, and pertussis, also known as whooping cough, can lead to serious complications and hospitalizations, especially in vulnerable populations like infants and immunocompromised individuals. Currently, influenza, SARS-CoV-2, and pertussis have vaccines available that help to prevent infections or reduce the severity of illness. Your facility's health consultant can speak more to the specifics of these vaccinations if there are any questions or concerns. Please note that the illnesses listed on these charts are not an exhaustive list of reportable diseases in the state of Colorado. You can refer to the link below, the flow charts, which will take you to the Infectious Disease in Childcare and School Settings Guide for a detailed list of all reportable diseases. When a child presents with an illness or a guardian calls out a sick child, documenting in an illness log is required and to be maintained in each licensed program. When an environmental health specialist comes in to do a routine visit, we will ask to see the last 2 months of logs. Filling it out completely is not only helpful, but a requirement as stated in the regulations. A through F, that's the basic information to gather on each child who presents with illness or a guardian calls them out sick. This approved illness log developed by CDPHE allows for all the information required. If you have a formal diagnosis, you may put that in the symptom column. Treatment action can be as simple as child stay home, child went home. There are times when a child is hospitalized, and you may put that under the treatment/action column. We love dates here at ACPH, so making sure to put the date of onset of symptoms or illness and the date of return is a very important factor when it comes to mitigating an outbreak. Lastly, it's not required to track staff illness or illness that happens over the weekend, but it is very helpful when trying to mitigate an outbreak. You can click the link provided for access to the CDPHE illness surveillance log. This is the approved ACPH illness log, which captures the same information as the CDPHE log, but with Arapahoe County branding. Both are approved forms for capturing illness symptoms, diagnoses, and incubation periods. Click the link for access of the ACPH illness log. This is a very helpful tool called BugWatch, developed by the Children's Hospital of Colorado. It is a public-facing document that reports on the presence and prevalence of various pathogens in both hospitalized and outpatient children within Colorado. It's updated regularly and a very useful resource for doctors, childcare, schools, and parents. Feel free to share this site with parents as a guide and an indication of what is happening in the community regarding common infectious diseases. Before diving into this slide, it is important to know that not every outbreak will require a site visit from our team. However, if a facility has a high rate of illness with no improvements, a site visit may be warranted. Environmental health and our communicable disease team will consult with one another and decide the best way to move forward. 1 through 8 gives a good idea of what our procedure looks like for an outbreak investigation. Also, don't be put off with the word investigation. It is a very common verbiage in epidemiology, and it's simply how we gather, analyze information, and devise a plan. Now that I've gone over the regulations on reporting and logging illnesses, mitigating disease spread by using various control methods will help decrease the overall impact that high rates of illness has on your facility. Knowing what symptoms to look for or what steps you can do in limiting the transmissibility of pathogens helps to encourage health and safety for both children and staff, as well as aligning operations with the current regulations. Starting with food preparation. For those facilities that have a kitchen and do food preparation, it is important to be aware of illnesses and symptoms that would require exclusion from preparing food. This list gives common symptoms that pose a risk in spreading bacterial and viral pathogens. Some symptoms to look out for is vomiting, diarrhea, fever, and jaundice, which with jaundice, that could indicate hepatitis A, which is a highly contagious disease. Also, when in an active outbreak or high rates of illness, limiting activities is a control measure used to decrease disease spread. This list provides some examples of what limiting activities could look like for your facility. Things like discontinuing sensory table play or not using the multi-purpose spaces that you have, as well as rescheduling site-wide activities. These are all helpful steps in mitigating disease spread. Also notice sensory tables is in bold on the list. That is because the regulation revisions in April of 2025 include discontinuing the use of sensory tables in an active outbreak. With the regulation revisions, CDPHE released an updated guide to walk you through the cleanup process from vomiting and diarrheal incidences, which includes safe and effective disinfecting steps for various types of surfaces. Keep in mind, the new regulations require childcare facilities to have a written procedure for staff to follow when responding to vomiting or diarrheal events. With that said, here's a high-level overview. So number one, it's important to be using an approved disinfectant that includes killing norovirus, which is required. There's a link provided if you are unsure of which disinfectants kill norovirus. Moving on to number two, designating staff that will be trained in the cleanup procedure and carving out time for continued training and education to maintain the proper protocol. Number three, being up to date on what supplies are needed for safe cleanup is an important factor in reducing pathogen spread. This includes items like PPE and the suggested cleaning supplies. It is also good practice to have a vomit and fecal cleanup kit that can be easily accessed and include a hard copy of the cleanup procedure, which a link is also provided on the bottom of this slide. And then lastly, number four, the new cleanup procedure details the steps required in disinfecting various types of surfaces as well as after cleanup steps. You will not be left guessing, as the new cleanup guidelines are very comprehensive. Getting acquainted with both the Infectious Disease in Childcare and School Settings Guide as well as the CDPHE vomiting and diarrheal incident cleanup procedure plays a significant role in controlling disease spread for both children, staff, and the families you serve. ACPH is hopeful that this webinar provides useful information and guidance on disease prevention and personal health based on the health and sanitation regulations for child cares in Colorado. The key takeaways are this: to report suspected outbreaks to ACPH, and keeping in mind there does not need to be a formal diagnosis and that similar symptoms in children and staff is sufficient. Illness logs need to be kept up to date and complete. This helps when we investigate a suspected outbreak. Lastly, controlling disease spread using resources available to you by CDPHE and ACPH plays a significant role in happy, healthy children and staff. I want to end this webinar by thanking you for your partnership. Arapahoe County Public Health values your input, and we encourage you to reach out with any questions you may have going forward.